I haven't seen myself look straight on in a long time.
Until her surgery, it had been years since Elizabeth Allen saw eye to eye with anyone.
I couldn't look straight on at myself in the mirror either, so like little things, just the way that I had to look at myself, and I couldn't make myself look straight. I hadn't seen my own ear in like multiple years.
About 13 million Americans face a similar challenge from a condition called strabismus. It means the eyes are misaligned in some way. One or sometimes both drift inward or outward, up or down. While strabismus appears more often during childhood, it can be a problem for adults like Elizabeth as well.
By the time that I saw her and we started talking about the need for considering surgery, the misalignment had gotten much bigger because her eyes didn't move out at all.
Dr. Sylvia Yu is an ophthalmologist and director of the strabismus service at Tufts Medical Center.
Sometimes it can cause a patient to notice that they're looking at two things at once, and it can cause a lot of difficulty just with day-to-day activities, including walking, of course driving, things like that.
Strokes are the leading cause of strabismus in adults. Other risk factors include head injuries or specific health problems such as diabetes. In Elizabeth's case, doctors believe the likely trigger was from a brain tumor diagnosed when she was 11.
Control of the muscles of the eyes come from the brain. So whether it was the surgery that she had for the cancer, or maybe some of the other treatments that she needed, affected one of the nerves in both eyes that affect the movement of the eyes. Sometimes it can recover, but because it didn't recover fully, the eye misalignment just got worse over time.
As a teenager, Elizabeth wore special prisms in her glasses to correct her double vision. It worked for a while, but then 5 years ago, Elizabeth noticed a change.
You could really start to see both of my eyes turning inward.
It was a clear sign. Some of Elizabeth's eye muscles were getting weaker, and others were getting tighter. Dr. Yu recommended surgery.
My goal was to be able to make it so that she can keep her head straight, to be able to look at something and look at the person she's talking to. Ideally, make it so that she doesn't have double vision when she's looking straight ahead, and also when she's looking down, because those are kind of the eye positions of the eyes that we use the most.
After a 2-hour procedure, Elizabeth says she can finally see straight, and she's enjoying the view.
There are no restrictions on what I can do.
Yeah, Elizabeth says the double vision is gone, and yes, she can finally see both of her ears in the mirror after all these years. If you want to learn more about options for adults with strabismus, you can go to our website, WCVB.com, and on our WCVB app. Ben and Erica.